All right. Good morning, good afternoon, good evening. Depends on where you are connected with us. Today is a very, very special show, okay? What kind of a woman will be hosting a free show on her birthday? Some of you might not know, today is Dr. Kina's birthday. Whoa! So it's going to be a special birthday. So just forgive us in advance because it's going to be a celebration as well as a show. So just for you to know, feel free to type happy birthday to her wherever you are. Okay, if you are watching this on Facebook, come on, do us a favor, share this video and type happy birthday to you, Dr. Kina Omeneko. Okay, so I'm not alone. As usual, we have the panelists in the studio. I have my host in the show, and then of course we have the celebrant of today that's supposed to be marking her birthday somewhere in Hawaii, but still chose to be with you today to celebrate her birthday with you. So let me kick the ball rolling by bringing in our co-host to introduce himself first. Today, I'm starting with a man. Okay, over to you, Mr. Alex.
Yeah, Dr. Kina, happy birthday. Let me start with that. Happy birthday to you. You've been a wonderful lady. You've been amazing. We thank God for you. Like Dr. Manuel said, I'm a co-host to this program, and we're here again. Thank you very much. You're welcome.
Awesome. And also, we have our panelists in the house. So I'm going to be bringing them to say hello and to introduce themselves to you, what they do, and of course, to wish our host happy birthday. Okay, over to you, Dr. Ebele. Precious.
Good afternoon, everyone. My name is Dr. Ebele Precious Obiora. I'm here to contribute my bit to this sector of medicine, oral medicine, and dentistry. I graduated from University of Texas in Houston in 2009 with the degree of Doctor in Dental Surgery. Prior to that, I graduated from UT Southwestern with bachelor's degree in Medical Lab Science. I've been practicing the field of dentistry for about 13 years now, and currently working in the Dallas-Fort Worth Metroplex area. I'm very happy to be here. And before I hand back over, I'd like to do a quick shout out to some people, to the panelists, especially Alex. You've been wonderful in corresponding leading up to this moment. I want to give a quick shout out and happy birthday to Dr. Kina for creating a platform like this to help disseminate this vital information to the masses. Is there something that is highly needed, especially in this field of dentistry, in my opinion, that is highly neglected, especially by my people. So, which are the reasons I may not be able to have time to get into today. But I also want to give a shout out to my husband. I know he's watching. Hi, baby. And my beautiful children. My beautiful children, my family at large. I want to say welcome. Thank you, my hygienist. I've worked with her for several years, Takari, and my mentor, Pastor Emmanuel Omosen. This is Pastor Emmanuel here too, but Pastor Emmanuel Omosen, my friends who didn't relent in sharing this in all social media platforms. Love you guys, and thank you everyone that is watching, and you're welcome.
Wow, that was a very good. I can see Dozie say, hi, Mom. Kenneth say, hi, Mommy. All right. Okay, over to you, Dr. Takari.
Yes, I'm Chikari Obina, and I've worked with the doctor. We worked together for quite some time, and she's a wonderful dentist. I was so privileged that she invited me to work with you all today, and looks like a queen was born today. So I just wanted to say I'm so pleased to be here, and thank you so much for having me. And I've been a hygienist for close to 13 years now. I was born and raised in Texas in a small country town called Amarillo. It's up in the Panhandle. If you look at a map of Texas, you see it right up in the corner. So a pleasure to meet everybody, and thank you so much for having me.
Awesome, awesome, awesome. And just as I said, please forgive me in advance because today is celebration. At the same time, we're still going to give you value as usual right on this show. So some people are not here with us on this in the studio, but they also want to say happy birthday to the host of this show. Okay, let's.
Hello, Kina. Happy birthday. Today is a blessed day for you. And I pray that God Almighty will continue to bless, keep you, and also bless the works of your hand. You are such a special person. I just want you to know that. And know that you are loved and you will continue to be loved. My BFF friend from before and today. So you're doing a wonderful work in the world, and God will replenish your resources wherever it comes from and continue to protect, guide you, and also lead your family in the ways of your heart, of your desire. And I thank God that I know you, that I'm in your life, and I pray that you will continue to do what you're doing in good health in Jesus' name. Amen.
Awesome, awesome, awesome. Happy birthday. Okay, let me hand over to Mr. Alex as he pilot the keynote of today's show. But you'll be seeing me, I'll be coming in and out, in and out, in and out. Okay, over to you, Mr. Alex.
Before Mr. Alex says anything, Pastor Emmanuel is carried away with this birthday thing. Hi, I am Dr. Kino Manokora. You all know me. Today, we're going to be discussing a very critical area of healthcare, like Dr. Precious mentioned earlier today, that is really neglected, the dental and oral care. What is dental and oral care, and how do you achieve that? What is the goal for getting a good oral and dental care? And what happens to our overall health when it's neglected? So today we have Dr. Precious and Takari, a dental hygienist. They are the experts in this area. So sit back and enjoy the show. Welcome.
Awesome, awesome, awesome. You know, I just forgot to bring in our host because I thought you guys already know her. I mean, I'm still wondering what kind of a woman will be hosting a free show on her birthday. Anyway, over to you, Mr. Alex.
So Precious, we start to directly get into business. And I want to ask, you need to let us understand, what do we mean when we begin to talk about dental and oral care? Can you give us a broad explanation?
Yes, basically, dental and oral care is from here up. You have the head, the face, the cheeks, the lymph nodes, the tongue, the palate, the salivary glands, everything basically, and finally the teeth. So making sure those areas are in good condition and disease-free is the goal.
So why is it important to make sure those areas are in good condition?
It's important for so many reasons. I'll start by saying what I think is the most important is the connection of oral health and bad oral health to variety of systemic diseases, which is what I think most people are not aware of. We have a presentation in the oral cavity that has so many links to a lot of systemic chronic diseases like diabetes, and I guess we'll get into that later on, but keeping a good systemic health is vital, and keeping a good oral health is vital also in maintaining good systemic health. And on a lighter note, there's a part of it that is not so serious, but serious as well. There is this social part of it. Like if you permit me to be casual a little bit, I hear all the time about a group of men or women that are not romantic. They don't like to kiss their wives, or they don't like to kiss their husbands. And this, if you look deeper into it, you might find that it's not just that they're not romantic, because if your mouth is not smelling good, you're not likely to grab anybody to kiss. So there is that social factor of, and you're not going to be able to
Can you repeat that statement? Can you repeat that statement, please?
Louder. Louder.
I said there's a social factor to this thing. In terms of if your oral health is not in good condition, you're running the risk of mouth odor. And if the mouth odor is a problem, you're not likely to grab anybody to kiss or approach anybody for date or things like that. And you're not going to, if you don't look good, because smile is important, and this is also a factor, you are not going to be as confident as you could be. And that could also affect other areas of your life, because if you're not having a good smile, you may not be able to walk into a room and own it. And so self-confidence is a big part of it. And we talked about the systemic. Enjoying your food is a big part of it, because if you've had a dental pain or anything happening in the mouth that is related to pain, you will agree with me. Like, I've had patients say all the time that is worse than childbirth. So you're not going to be able to enjoy your food or eat.
Wow.
As I said, sorry, I'm going to be interjecting. Today is a celebration as well as a show, okay? So just bear with us as we flow along.
Happy birthday, Auntie Kina. We thank you for everything you've done. We wish you many more years in Jesus' name.
Amen.
All right. Over to Mr. Alex.
Takari, most people sit back and they go like, well, I'm not having any toothache. But I know the recommendation is for people to get their teeth cleaned twice a year.
Yes.
Could you shed some light on why people should go to the dentist and get their teeth cleaned?
Well, preventative service is one of the most important things, because it will help you determine, where you're at. Sometimes patients have hereditary things that they don't really understand. So going to your dental health provider twice a year will help you understand, where you're at with your dental needs. Sometimes there are little things that we can see that you sometimes can't see. So it's important to make those checkups, because we're able to determine certain things, because we are the professionals to be able to help you figure out what you do need for your dental services and the things that will work best for you.
Thank you. Dr. Precious, do you want to add to that?
She said it perfectly. Prevention is the key, because if you can prevent it from happening, it costs you less time, and is actually we get towards prevention than cure.
Yeah.
All right. It's like we have someone that has not really introduced himself. Do you want him to introduce himself, or do you want to introduce him, Dr. Kina?
Let him introduce himself, and he can share a little bit of why he's on the show with us today. And I'll let Dr. Precious handle that case.
Over to you.
Okay. Thank you, everybody. It's a pleasure to be with you guys today. I've always gotten the hint about the show, and this is my first time I'm coming on live. My name is Prince Oleru. I'm from Imo State. Dr. Kina is my mother. She's a big mom to me, and I've always wanted to be a part and support to the whole medical process. And when I saw the topic for today, I said, yes, this is me. And I would like to come on the show now to express my own part about the dental care and oral health.
Awesome. So I believe we'll be bringing you in as we go along anytime as fit. Okay, over to you, Mr. Alex.
Yeah, I don't know. Now, Dakari, you talked about prevention is better than cure and is the key. So what are the types of care we are supposed to be taking in terms of oral care? What are the types? What are the kinds of care everybody needs to be making sure he complies with? Because you need to know what you need to do.
Oh, that question was for me.
Yes. What are the types? You
What
said
are-
prevention. How do we do this prevention? What type of cares are we supposed to be
the things that the first thing is to have a routine. Each person we're all individuals, and like I was saying before, they have the old saying of a pound of prevention is a pinch of prevention is worth a pound of cure. So knowing like your specific needs, when you're dealing with patients, and a lot of times when they have a rampant decay, a lot of times you'll ask the question, do you have family members that have dentures early? Those are kind of things that will help you determine if they're going to need to have a prescription toothpaste that has more fluoride. That will help them deter them from getting more cavities in the future. Those type of things. You want to help them to understand how important flossing is. A lot of times people don't understand how important what's in between your teeth is just as important as what's on your teeth. We have an old saying in dentistry, only floss the teeth you will keep, because it's so important to floss. About 98% of all gum disease cases starts in between the teeth. So it's very important, and that's those little things there. It's having a routine and then keeping the routine. The routine is a part of having regular dental visits. And when you have those visits, listening to, if you trust your dental care provider, like Dr. E is an excellent dentist. She wins over everybody. She's wonderful, but she's also, very smart at her craft, so you can trust her word is valid, and she's very smart. So you would want to take her advice. You see patients lose their teeth because they don't take the advice that their healthcare provider has given them. So those are the steps. You want to, keep those visits. You want to maintain, and you'd also want to take the advice that your professional dental health provider is giving you, and you want to execute.
All right, awesome. As I said, please, you go be forgiving me, okay? I'm going to be coming in and out, because as we have greetings coming in, we just have to display it. Okay, this is one of...
On behalf of myself and my family and the entire staff of David Emeneko Foundation here in Nigeria, we wish to thank God for the gift of the Chief Executive Officer, David Emeneko Foundation, Dr. Kino Emeneko. We wish to thank God for her life and wish her a lovely and prosperous birthday, and ask God for more protection.
Okay, over to you, Mr. Alex.
Yeah, I think Kina should take over this time.
Yes, Dr. Precious, what are the most common dental problems that individuals encounter?
The most common problems I would say is tooth decay, caries, sensitivity, cracks, receding gum, gingivitis, periodontitis, also known as gum disease. I would say this will be the most common.
Okay.
And so, what are the red flags you notice? For me, for instance, you don't have any teeth problem. Takari has not told us whether somebody who is normal needs to visit the dentist. Again, what red flags do you see before you can start taking certain steps? Yeah, Dr. Precious, back to you.
Actually, here in America, parents are required to start taking their kids to the dentist at 6 months old. It's actually mandatory, especially if they're getting any government-assisted help. They have to. So by the time you see any red flags or you see anything that concerns you, it's already too late, or it's an emergency. And obviously, like we said earlier, our people tend to, I don't see a lot of percentage of our people, sadly, but when I do see them, it's usually an emergency situation. So by the time you're seeing a red flag, the reason why you should go see a dentist is already late. So basically, you should see your dentist before you even notice anything, because this thing is very chronic. Chronic means it takes a long time to develop. So when you have a toothache today, when you are coming a cavity, it may take a year before it happens. It may take 2 years, but eventually it will happen. And when it does happen, it's going to cost you more money, which is why they say dentists are so expensive. We're expensive because by the time you come to us, it's already late. We have to do extensive work to restore function, if it's able to restore function, because sometimes it may have to be taken out. And you talk about red flags. I also want to expatiate a little bit on the connection for these diseases, because even systemic diseases like diabetes and things like that could also make, present in the mouth or show that there's an issue going on in the mouth. If I may give example, like when you have chronic inflammation in the mouth, which is usually the case, like about 90% of everybody has gingivitis or has gingivitis. And about 50% of adults over 30 years old, like about 50% of adults over 30 years old, yes, have periodontal disease or gum disease. And this basically is inflammation that is in the mouth that is persistent. And when left untreated, this inflammation, the bacteria can get into the heart and begin through your arteries and begin to form plaque in your arteries. And when that happens, it's called atherosclerosis. And this can lead to high blood pressure. This can lead to heart attack. This can even lead to stroke. And when these bacteria get in the lining of your heart, that's what everybody in healthcare knows about bacterial endocarditis. That's basically what it is. Mostly the culprit is bacteria that goes from the mouth. So it's vast. And when there are other areas like diabetes is chronic systemic inflammation kind of promotes insulin resistance. And we know insulin resistance is basically what diabetes is, at least some part of it. And that is also exacerbated by chronic inflammation in the mouth. So they have a two-way relationship. And there's one that is going to shock you. If I tell you that erectile dysfunction is somehow related.
I've heard about this.
Yeah, so men, go see your dentist.
Wow.
And thank me later.
Yes, I've heard about this.
This is too much. But anyway, before we continue, please forgive me. Before we continue, we have someone in the studio.
But she hasn't finished. I don't think she finished. She hasn't landed.
Oh, okay. Have you landed or you're about to land?
She's about to land.
It's so vast. We're probably not going to land today if we land, but I can.
Because we might have part two.
My God. Oh, God. You don't want to land. Okay, no problem.
No, I can just mention the diseases. So at least people will be aware and mention it fast. There's even lung disease, even your liver, your kidney disease, everything, infertility, diabetes, even a complication during pregnancy, they're all connected. So basically, some people say the mouth is the gateway to the body. Okay, so if the mouth is not doing well, the rest of your body is going to suffer, basically.
Wow.
I never perceive it this way at all. I will be honest. I will be honest with you. I've been in US now for 15 years. I've never seen a dentist. But I promise you, with this show, I'll go
Well, Pastor Emmanuel, guess what? She's your neighbor too. She's in Ball Springs, so you have no excuse anymore.
Wow. Well, we have two people that we are keeping. As I said, we might be having part two of this show because there's no way we can finish today because we are doing two in one show. Okay, we are giving value out to you. At the same time, we are celebrating this woman that all she just cares about is about other people, just about you. She doesn't have to do this show. She doesn't have to organize this. I mean, just look at it. She doesn't have to be the reason why we are all converged in this place. And you have no idea people that this program reach out to, people that watch, both the lovers and the haters, those that watch it and say, what is it that they are doing? And the one that watch it and say, wow, these people are doing good. But there's somebody also here that I know we've just listened to his recording, but he would like to introduce himself to our viewers and also to wish Dr. Kina happy birthday. Over to you, Dr. Bright.
Thank you very much, Dr. Emmanuel. I apologize for
the late entrance. I was having technical issue. But before I continue, I wish to celebrate the Chief Executive Officer whose life is all about humanity. I want to wish her a happy birthday, a lovely one indeed, and pray for more protection and more God's blessings on her head, because she's really doing a wonderful job. Thank you so much, Damkina. Happy birthday. So let me come in this way. David Omenoko Foundation started our free mammogram exercise here on October 28th that will last to November 28th. And at this point, we wish to thank our donors, our benefactors and benefactresses, beginning from here in Nigeria and in other parts of the world, especially in the US. We can't do this without you. As I speak with you, we have over 15 cases right now going under scrutiny.
Oh no, oh no, oh
We
no.
cannot do it without you. Like I said, the 15 cases, we are monitoring them closely, and we will let you know what the outcome will be, depending on the advice of the oncologist. As I speak with you too, over 160 women have undergone this screening, and a lot of them are great for a lot.
No. Let's begin.
We wish to give you a brief update of what we are doing, and maybe the end of the show we'll do a holistic approach. Thank you.
Awesome.
I want to join Dr. Kina Meneko's friends, well-wishers, fans, and admirers to celebrate with her on the occasion of this year's birthday. Dr. Kina, we want to let you know that you've been wonderful. You are an amazing lady. We cherish and appreciate all you are doing for the society and for the community, for friends and relations. We are asking God to give you many more years to enable you continue to do the good work you are doing in the society and to continue to glorify the name of God. Happy birthday.
Done so much for me, I cannot tell it all. If I had 10,000 tongues, it still wouldn't be enough. Tuku na kwamba really, when you hear completely.
Jehovah, for he has done so very much for me.
Come on, everybody.
What shall I render to Jehovah?
Hey!
For he has done so very much for me.
night will grow, we continue, we cannot finish today. I mean, one thing with me is that I love to celebrate the living when they are still alive. Some people love to celebrate the dead, but they are gone. They don't know what they have done. So let's learn to celebrate one another when they are alive. Over to you. I think it's time for us to bring in Prince. Dr. Kina, you want to answer that?
Yeah, Prince, can you share with us some of the dental issues that you're having? Maybe Dr. Precious will shed some light, and maybe you can get some information on how to take care of the issue. Go ahead.
Okay. Okay, thank you very much. I've waited for these moments to come, and we are here now. Now, I've had a very crazy dental formation growing up in my team, and I've not gotten an answer. I've not gotten the reason why my dental looked that way. First of all, in my teenage age, when I pulled my molar tooth at the down jaw, when I pulled them off, it wants to grow. It grows two tooths. Like two different tooths comes out from one spot. And I saw it, and it wasn't giving me a problem. It was still well balanced. But in between those two tooths, I had a hole. So I always pick my tooth. It got to a point, pick. I created a deep hole down to the gum. And I went to the doctor. They pulled out one of it. The other fell in line, and they did a root canal on that. But there's one part of it that's still wondering me till date. At my upper jaw region, same molar space, the tooth has an extra growth from there. It's growing like there's an extra tooth growing in my upper jaw, which to today, I asked the doctor, they said is a form of excessive calcium during pregnancy from my mom and stuff like that. It's not disturbing me, but it keeps me wondering. I'm supposed to be having 32 tooths, but I'm having 33 now. And I don't know why I'm having an extra one. I'm still scared if there'll be an extra one going up on this part of it. And I've not gotten an answer to that. I want to know what's the reason. Why am I having such crazy dental formation, please?
So who are we to send the invoice to? Because this is a free consultation that we're going to do right now. So over to you, Dr. Precious. Then we can Dr. Takari.
So did we get who will send the invoice to?
I'm going to send a video. I'm going to send a video of that region. I'm going to send the video so that you could view it from the video and see what I'm saying.
He's adding more consultation issue.
The bill will go up. The bill will go higher.
Oh,
yes,
God. I need this now. I need it.
Yes. First of all, thank you for your question. Is something that baffles a lot of people. I'll start by saying that what you have, you can't hear me. Hold on.
We can hear you.
We can hear you.
Okay, sorry about that. Okay, what you have is something we call supernumerary teeth. That means you're growing more teeth than the usual. It's an anomaly, but it happens very often. We see it all the time. Okay, but what I can assure you is that the one you said is growing now didn't just start growing. It was already there, but your teeth shift and move throughout your life. From beginning, when you're a child, you have the baby teeth, they follow the adult ones come in. Sometimes you have tooth buds that are two, they become twins for reasons we don't know. Just like you have bones in your body, you have multiple bats and things like that. So things like that happen, and the only one that can answer that particular one is God. But we see it all the time, and what we're concerned about is pathology. As long as there's no pathology, you're fine, and it's aligned properly, you're fine. If it's not, which usually it will not be, because you have enough room for basically 28 teeth, really, which is why most of the wisdom teeth are pulled out. So if it's not aligned, then we pull it out. We pull it out because sometimes it causes problems because you don't have, like you said, things get stuck in the middle, you cannot clean properly. So we pull them out in order to restore that a good occlusion and a good alignment of teeth. So that's what it is. It's not really that rare. It happens a lot. we see people with crazy amount of teeth. And like I said again, it's not a problem. It doesn't bother you. Will not do anything to you unless there is pathology involved. Then we worry about it.
Okay. You see?
Wow.
Nice.
So now your mind is at peace, right?
Now I know. Now I know. Thank you very much, Dr. Precious.
You're welcome.
All right. Thank you, Prince.
Mr.
Alex. Yeah, Dr. Precious and Takari. You know, you've talked about so much how the oral cavity, the teeth, and everything connects to the whole body, and people are going like, "Wow." Can you tell us a little bit more what people need to really do as a preventative care, oral care? What do they expect when they come to the dentist? And I know we've talked about they should be visiting the dentist twice a year, but can you please outline when they need to start going to the dentist and what to expect once they're in your office?
Yeah, go ahead.
So there was several questions that you asked. Which one did you want me to start with?
I want you to let us know what people need what should they expect? Because a lot of people wouldn't go to the dentist. One, because they're not having any issues. Two, they said that when they go to get their teeth cleaned, that they scrape the teeth until the teeth gets thin and they will lose their teeth. So people are scared of that. And then another thing is that they're scared because by the time you do deep cleaning, that it hurts so bad. So who wants to go to a dentist?
Well, that's a part of, the initial visit may not be, you need to go because it's a part of your health. First of all, like Dr. was saying, it's extremely important because it's a part of your overall health. Some years ago, always in dentistry, we knew that heart and mouth were associated, but a couple of years ago, MD Anderson, they paid a lot of money to prove that heart disease and gum disease, they are related health-wise. So you have to go if you want a good heart, they're related. So those are you need to be there. If a person is afraid to go to the dentist, your teeth aren't going to be scraped off. I always tell patients one of the strongest substance in the body is enamel. It's so strong. You see skulls that they find that have been buried for thousands of years. What do they still have intact on their skull? Teeth. Teeth are designed to withstand so much. So, you have to get over that first hump. Our teeth are so strong. Our Heavenly Father created us almost perfect. You'll be okay. The initial visit is very tough. If you go ahead and go, you're going to save your teeth and it will save you money in the long run because the preventative things are much cheaper than the specialty things. So what you're going to expect is x-rays, of course. You're going to expect if you do have problems, the treatment plan, and you'll expect to have your teeth clean. Now, if you're sensitive, we make products for sensitivity. Products like a lot of times if my patients have sensitive teeth and they come in and they have dental anxiety. Dental anxiety is a very real thing like white coat syndrome. Patients that see a white coat a lot of times will have high blood pressure. You can alleviate all of those things, but you can sure relax a patient to let them know if you're afraid of pain, we can do oral things like put topical on the teeth to help a patient feel more comfortable if they don't want to feel any type of physical pain. But your initial visit will only be what we call an exam. So if I have a patient and they come in and they haven't been to the dentist in a long time, what we would say to them is, let's start with the x-rays. A lot of times patients are nervous and we're not going to do anything yet. let's just take a look, and that will put a patient at ease. And a patient also will need to understand that you're in charge of your body. So any healthcare provider, especially in dentistry, we're not going to do anything that you're not going to allow us to do. So you have to walk in with the sense that you're in charge. So you're there to get help, and we're there to help. So it should be an atmosphere of love and a welcoming atmosphere. There's dentistry is amazing. There's so many innovative, wonderful things that we can do to make you comfortable. You just need the first step is to get through the door, because there's something for everyone. And there's something for everyone's budget. So when you're there, your first visit, you don't have to come in expecting treatment. Come in with an open mind, expecting to hear some type of news that will help you to become a better you. Because we all know, we've seen the patient. I know doctor has seen the patient. When patients lose their teeth, it changes you. You've seen the patient when they lose their teeth, it changes who you are mentally and physically. So it's very important to make that first trip to just come to the dentist.
Wow. Well, we have a question from one of our viewers, from Erica. No, Regina. Says, I have a hole at the molars, but don't know how to really follow up on the solution. Does any of you have any response?
You're not supposed to know. That's for your dentist to know. You just need to go to the dentist.
Okay, so I believe he had that. That's okay. All you just have to do is just make sure you go to your dentist. That's why we're having this show.
Happy birthday to you. Happy birthday to you. Happy birthday, happy birthday, happy birthday to you.
Happy birthday to you. Happy birthday to you. Happy birthday to Dr. Kina. Happy birthday to you. Today is your special day, and my family and I will wish you a wonderful, wonderful birthday celebration, even as you mark your birthday today. In the mighty name of Jesus, God Almighty will longer your life in sound health. As you are looking to the betterment of others, the Lord will say to you in the mighty name of Jesus. God bless you. Happy birthday to you.
All right, Mr. Alex, over to you.
Dr. Precious, you've been able to tell us the different types of dangers we face by poor dental care, a lot of diseases, as well as but can you let us also know what causes dental disease? What are the factors that cause tooth decay and these problems? Can we address that now?
A lot of factors. The number one is genetics. In everything genetics has a part to play, because you see some people with the same exact, you can see twins with the same lifestyle, and one of them is more prone to tooth decay than the other. So genetics plays a part in it. Some people are more susceptible to some things. The same way one person will get COVID and they'll be okay, the other person will get COVID and end up in a ICU. So genetics is number one factor. Secondly, there are a lot of habits, there are a lot of lifestyle factors that are involved. Smoking is a big one, and lack of getting dental checkups is another one, because things that are caught on time can prevent it being exacerbating into other things. And oral hygiene is a big factor, because what is dental decay, by the way? Dental, I don't know if I'm the only one hearing me. Dental decay. Dental decay is a formation of plaque. Is basically when you eat food, there are always food particles in your mouth, and we all also know there's a flora in everyone. Everybody has bacteria in their mouth, but the problem is when there's overgrowth or when there's a habitation of the bad ones. It begins to accumulate on the surface of the teeth and gums. And when it combines with these food particles and mucus, it forms, it begins to produce, this bacteria begin to produce acid, and it forms what we call a biofilm. And that's when the problem starts. This biofilm forms constantly. That's why oral hygiene is very important, because each time you brush, each time you floss, each time you rinse, you are taking away these biofilms and you keep it from getting a hold and causing trouble. But when left untreated, or when left or when it's not removed, it begins to trigger inflammatory response throughout your body. Sometimes your body will even attack itself because it sees that it wants to get rid of it, and it begins to attack itself because of that. So basically, your question is what forms it? Is habit is a big part. What you eat, because if you eat a lot of sugar, you're going to likely have dental decay issues. If you eat things that contain acid, if you drink a lot of soda and things like that. So lifestyle is a big part of it. Genetics is a big part of it. Of course, diseases, like if you're diabetic, you're going to likely have a periodontitis. So other disease factors also affect the mouth, the same way the mouth affects other disease factors. So yeah, there's a lot of factors that we can talk about.
So I want you to talk about mouthwash. Some people were talking that mouthwash is a factor. The type, depending on the type you use, including toothpaste. So what do you react to that?
That mouthwash is a factor in what? In dental decay?
It can cause the teeth decay, or it can hurt the gum. And they said also the type of toothpaste use. I want you to comment on that.
I would like to ask these people where they're getting their information from, because that will help explain it.
Mouthwash is well, if you are dismissing it, that's part of the enlightenment, because a lot of people are misinformed.
Of course. Mouthwash does not cause any decay. Mouthwash actually helps you, but depending on what you're presenting, you will likely have to have a particular type of mouthwash. Like there's antiseptic, there's antibacterial, there's a regular one. If you're if you're having sensitivity, or if you don't want to use the one that has alcohol, or if you have dry mouth, because alcohol will dry you out even more. So you are likely to use antibacterial. And if you're having if your bacteria is a problem, antibacterial will be a good one. But if you're not having a dry mouth, antiseptic is a good one. Altogether, I would say if you can get Listerine, is good enough, because Listerine is a cost-effective and it does the job.
So let me quickly ask you this question. Either of you can answer. So how often are we supposed to brush our teeth?
Sakari?
Because sometimes maybe I forgot to brush my teeth in the morning, and my wife will be saying, okay, you've not brushed today. And I will say, well, what I was told is brush daily, brush your teeth daily. So if I brush my teeth in the evening, I think I'm still within the line. So how often are we supposed to brush our teeth?
Well, that really, you start with twice a day, first thing in the morning. You do that for others because you don't want to walk around and hurt other people's feelings. The evening, you really do that for yourself, for your own health. The last thing you do in the evening is you want to brush your teeth, because you want to get out particles. You want to get out any sugar. The sugar that we put in our mouth, like bread and things like that, that's the sugar that dental decay loves. That's where cavities come from. So I have a daughter that she took her father's teeth, and she gets cavities so easily. And it's important, like if you are more prone to cavities, you have to brush your teeth before you go to bed to get out any of those bread particles. Bread is like sugar to dental bugs, So you have to make sure you set the standard there. Now, if you have any type of ortho, you're going to need to brush your teeth anytime you eat. You don't necessarily have to use toothpaste. I tell my young patients, if you're at school and you have braces, get your toothbrush, wet it, and you're wanting to brush the particles out, because the worst thing you can do is leave that sitting on your teeth, because the particles there, they are adhering to that biofilm that doctor was talking about, and it's there and it's working on the enamel of the teeth. So it just depends on each specific person, but especially if your children or you have any type of dental appliance, you want to make sure to keep those type of things clean, because they're adhering to other teeth structures and they can cause more problems. So we start with twice a day, and then of course we lead into more if you need to. If you're eating anything sticky or anything like that, you make sure you get those things out of your teeth after you eat them.
All right. Well, please, before you say that, we also have a question from our viewers, because they are the reason why we are here. This is from Kenne. He or she, okay, she says, I have a question. This is your daughter, right?
Yes.
Oh, okay. Sometimes my gums bleed when I brush, and I'm too scared to go to a dentist. And she's too scared to even go to mommy because I may be. Am I brushing too hard, or could that be something else? Who wants to answer?
Takari, you want to answer?
Okay, I have a question. Let's see. Well, you're not alone, sweetheart, because a lot of people, feel like they'll be judged, and sometimes things are hereditary a lot of times. So don't feel judged. Bleeding gums, healthy gums don't bleed. That's the first thing. So there is normally a problem. If you see generalized bleeding, like most of your gums are bleeding, we definitely want to get you in for a good cleaning, because that would probably mean that we're getting bacteria around the teeth where the gums are meeting with the teeth. So if you look closely, sometimes you can see on some people's teeth a little white that they get at the bottom where the gums meet. It's called, the clinical term is called calculus, but we call it like tartar in the common sector. So that is nothing but very highly inflammatory bacteria. And once it gets around the gum line, it makes the gums inflamed, and that's where you get the bleeding from. And once plaque, takes about 10 days for plaque, the soft stuff that you can take and scrape off your teeth. It takes about 10 days for that to turn into a calcified, very hard substance that sticks to the teeth. That's called tartar. Then you can't remove that. So what will happen, it'll sit there, it'll get hard, it'll make the gums very inflamed. So when you see red inflamed gums, they tend to bleed. And you can't remove tartar. It has to be removed by a dental health professional with specific instruments. So you're probably just suffering from what we call gingivitis. And gingivitis, if left untreated, can turn into periodontitis. So we want to nip that in the bud while it's very, very small.
Wow. Our time is fast spent, but before I yield to the host or Mr. Alex, there's another question I would like to ask. Started this in the last episode. So just to help the young adults or teenagers or those that are in the midst of career choice or deciding on career path. So if someone is watching right now and this person wants to become a dentist, what does it entail? Like career choice or the path, what does it entail? Let's say somebody just graduated from college, or maybe one of the immigrants and still want to become a dentist. So what does it entail generally?
Basically, the same thing it entails to become a physician. You have to go to a 4-year college, get your bachelor's degree, then hopefully in a relating field, and then start applying to dental school and take an entrance exam. And if you meet the score and everything, they look into everything. They look at your life, your social life, your character, what you have done so far to your contribution to the society. And then, of course, that score for that exam, and then that degree, and then your undergrad scores. They look at your GPA and all that. So if you qualify, of course, they call you for an interview and then pick you if you pass that as well.
All right. Well, I don't know if we go finish.
So Dr. Precious, how many years is after the first degree? How many years is it to graduate from dentistry?
4 years. Then after that 4 years, you now go into specialization. You now, depending on your specialization, you do another 1 year, 2 years, another 4 years, depending on your area of specialization.
That's like 12 years.
Yes, one last question. Dr. Precious, people have sometimes experienced their teeth falling out. I know sometimes it's common. People just wake up, they see a teeth falling out. So what do you think causes people's teeth or tooth to fall off like that?
First of all, the tooth just didn't fall out. It was years of persistent, untreated gum disease, inflammation,
more
inflammation, infection that left untreated. So if the teeth fell out and that's all that person had, they're doing good, because it could have led to other things that are worse than just your tooth falling out. So if your gum disease is, like Takari said, gingivitis left untreated, periodontitis left untreated, definitely that tooth will eventually fall out one day. Some people think that people's teeth fall out because they're old. It's not because you're old. It fell out because you have a disease process that you didn't get treated.
Wow.
Wow. Well, it's been an awesome sessions. I don't know if there's going to be part 2 of this, because I believe seriously that we have not really explored all the questions. And forgive me, because also today is 2 in 1. We are celebrating the host, and I think it's necessary. It's just necessary, while we are also dishing out values. So as usual, also we normally like to take what is called the elevator speech, just like a take-home 1-minute pitch from you, someone that has been watching. What do you want this person to go home with? But before we get into that, maybe one way or the other, let's just say happy birthday to our host.
What shall I render to Jehovah? For he has done. What shall I render to Jehovah?
Lift your hands.
All right. So our time is fast spent. So I'm going to start from Dr. Takari. Someone has been watching us, and you just want this person to go home with one thing. Just one thing, just one. In 30 seconds, what would that be?
I'm a hygienist, and so I want to make sure to give honor to the real doctors. One thing that's very important, if you live in America, if you ever have questions about what products to use, the American Dental Seal of there's a seal, the ADA Seal of Approval. You'll see it. It's like a little triangle, and it takes a lot to get that seal. They take those companies through certain tests. You'll see certain dental products that won't have that seal of approval. But if you see products like, if you have Listerine at home and you look at the bottle, you'll see a little triangle and it has ADA, and that stands for the American Dental Association. That means that product has been tested and tried. There's certain requirements that product has to have in order to have that label. It has to have certain antibacterial, anti-cavity, anti-agents that help you fight cavities. So it takes a lot to get that seal. Those are things like that you could carry with you with your own dental knowledge, that you can pick a good product for yourself at home. So that's my final thing to say. And thank you.
Awesome. It's been a wonderful session, Dr. Precious.
Yes, I would like to also let people know what a dental hygienist is. We Takari, they are a wonderful hygienist. A hygienist is someone that has a bachelor's degree in the dental field, and they specialize in cleaning teeth. Because I notice a lot of people don't know this, and of course, the dentist is specialized in, of course, in treating the disease process that affect the oral cavity. And I would like people to take home that if you're having a toothache, please Don't just put charcoal in it. Go see your dentist. Thank you.
Well, there's no time for
or even salt. They use salt.
Because I would have asked. Because I remember we used to put salt inside.
Salt, yeah. Salt with warm water.
Yes.
Anyway, it is well. Mr. Alex, so what will you say?
Yeah, my take home is that you need to visit the dentist regularly and don't wait for the red flag.
Awesome. And of course, before we bring in the host once again, I think this show will not be completed if we, the panelists, do not sing happy birthday for her. So can we just go on the count of 1, 2, go? Happy birthday to you. Cha, cha, cha. Happy birthday to you. Happy birthday. Happy birthday. Happy birthday to me. Hip, hip, hip.
Hooray.
Hip, hip, hip.
Hooray.
Hip, hip.
Hooray.
All right, over to you, Dr.
Thank you all. Thank you all so much. Thank you, Dr. Precious. Thank you, Takari. Well, we all know that we didn't scratch this topic. So I'm going to ask that we have a part 2 to this topic, because everything you had said today, a lot of them were new information, new knowledge. So it just makes me wonder how many more people out there have no clue. I know a lot of people don't go to the dentist. That's the least thing people do, especially like you said in our community. So going back to what we've been learning in the last 2 years, it all boils down to 1, visit your healthcare provider. 2, eat healthy. 3, exercise. It just keeps going round and around and around. So I want to thank everyone and thank you all for the birthday wishes. I thank all of you because you guys have been so supportive to me. That's why I'm breathing. That's why I'm kicking. That's why I'm doing what I'm still doing today. And I pray that God will continue to give me more blessings and bless me with more people who are supportive. That way we can carry on this mission of helping others in the society. Thank you all, our well-wishers and our viewers, and we see you all again in the next show.